Hi guys. Welcome to our live chat. Tune in with RanDev. Let's unzip a topic. I'm Ranjini.
And I'm Devapriya, and today is our special edition episode, COVID-19 pandemic's special edition first episode. So, Ranjini, I'm sharing the screen now.
Yeah, sure.
Okay. So, is the screen is already on?
Yes. So let's.
Okay.
So today is the MCO 3.0 special edition episode 1, as mentioned by Priya. So let's share the episode. Priya, next slide.
Okay, so what is episode 1 is all about? It is COVID-19 pandemic MCO 3.0, the rules of the game. So, Ranjini, what we mean by the rules of the game? Are we in a game or something?
Okay, Priya. Yes, I know. Like the title is totally like sounds a little funny or maybe a little different than what maybe
Yeah.
people would have expected. Okay, why we put this as the rules of the game is, I mean, we have been going through this entire pandemic for more than a year now. Started sometime last
Yeah.
year, and it is a real life challenge that we have been going through, each and every one of us in Malaysia, and of course in world in general. So what I thought that why not we convert this, I mean, to make it a little bit more lighter, maybe a little bit more, I would say, fun, or maybe to convert the mode of facing this entire COVID and MCO and so on, is like maybe we personificate it into a what we call a video game. So
Yeah.
when we start to see like a video game, I'm sure the gamers, you definitely like games, right? Some of you guys like games, but let's make it a little light and see it like a video game. So this entire pandemic, this entire thing as a video game. So we are going to start. We have already started long ago, but we just wanted to refresh by every time when you want to start to play a game. Number one, you need to know about the game, all about the game, and also
Yeah.
the rules of the game. So since we are already going through the what we call the game, we are halfway through or almost towards the ending, God knows. So we just thought we are going to bring this special edition that way. So we're going to start back by refreshing on what is this COVID-19 is all about, and what are the rules of going through this entire pandemic until we reach the finishing line, or score the highest or something like that. So that's how we're going to bring this special edition, guys. So let's get into the
So,
first episode, Priya.
yeah, I totally like the idea to see this entire pandemic as a video game. I mean, not to mean that to reduce the seriousness of this COVID-19 pandemic, but in such a way to reduce the stress and burden of what we're thinking about this pandemic. Because I know definitely these entire pandemic MCO things were too much into our head. So just lighten it up, and shall we go to the first session of this episode? So, Ranjini, over to you.
Yep, that's right, exactly. So, first of all, what we're going to do is we're going to recap on what is COVID-19 is all about. I probably many of you guys know already what is COVID-19, but it is okay to recap for those who never really knew. I won't be surprised. So, let's have a recap. So, what is COVID-19 is all about basically, but before that, guys, we would like to stress that the source of information for today's episode is a combination from WHO website and then KKM website,
Yes.
and also some medical journals that we have reviewed before we in the process of doing this presentation to you guys. So back to my slide is what is COVID-19? COVID-19 is a disease caused by a new strain coronavirus. So the COVID-19 basically is Co is corona, and then VI is actually the virus, and D is the disease. Whereas the 19 is the year when it was found, it was reported,
Yeah.
2019. So, and it was originated from a market. I think most of y'all maybe would have known that it's actually originated from an exotic I mean, market selling exotic things at Wuhan, China.
Yeah.
And let's move to next. And
Yes.
in brief, the chronology of COVID-19 pandemic is like the first case of COVID-19 reported in human was in December 2019. I do not know I couldn't get the exact date, but we all know in December 2019 was reported in China. And then on the 11th March 2020, the DG of or Director General of WHO characterized COVID-19 as a pandemic. So of course they see some checklist. They would have some checklist on what a pandemic should be, and then they eventually declared, I won't say declared, but more I would say I would use the word characterize it as pandemic. And on 16th March 2020, our prime minister announced Malaysia will go through the movement control order MCO on the 18th March 2020. So I am sure that is the black day for many of us. It's a new thingy for most of us, including myself. So yeah,
Mm-hmm.
that's pretty much on the chronology of COVID pandemic. So over to you, Priya.
Okay. So it's been a year, and I think it's like 2 years already, right? Almost to 2 years. And here we are, the MCO phases in Malaysia. As you said, Ranjini, our first MCO were declared on 18th March 2020 until 31st March of 2020. And it goes on the phase 2, phase 3, phase 4. And I think by when okay, conditional movement control order, recovery movement control order, we go through certain phases
Yeah.
last year, and I think by July, exactly like a year before, we managed to reduce the case to single digit numbers, and even the death toll were very low. I mean, in single digit or either zero. So that was what we managed to do last year in this pandemic game. So when you speak about pandemic, when you characterize a disease as a pandemic, means it is not one or two country. I mean, the entire world, I mean almost the entire world have been affected by this single disease, single virus. And this is the chronology MCO phases in Malaysia, and currently we are in phase 1 of recovery plan, national recovery plan, from where our Perdana Menteri Malaysia declared our MCO during 1st June 2021. And currently, KL and Selangor, which is the highest number of cases every day, were being under PKPD right now. So
Yeah.
PKPD perketatkan. So I think people are following pretty much well, and we really hope that we can do the same magic as what we did last year at this same time. So let's move on.
Yeah.
Okay, so this is a challenging part, Ranjini, the COVID variants in Malaysia. When you speak about a virus, it is far more different from what is a bacteria will do. Virus tend to, I mean, it has the ability to modify itself according to the surrounding, according to the challenges. A clever organism, I will say. So variants means a single virus which took another phase, took another characteristic, modified itself and become new variants. So this is what exactly happened to even coronavirus. So currently in our country, Malaysia, we have these 4 variants of coronavirus. So these information were took from the Star Graphics, I mean, a reliable source as well. So the Alpha variant, where it is earliestly documented from United Kingdom, I mean UK, September 2020. So that was in Malaysia as well. And the beta variant B.1351, it is from South Africa. They declared, I mean, they found this variant from May 2020 last year. We also have the Gamma P.1, Brazil, November 2020. And the most, I would say, dangerous, maybe, which is the Delta variant from India, October 2020. I think speaking about India, we all have witnessed what India has gone through when this Delta variant been outbreak in that country. And that was a nightmare. I think totally in everyone in the world, because the struggle they have been through was like super high. And even for struggling to get the oxygen, it is, I think, the highest level of this the peak of this pandemic struggle, I guess. So currently all these variants have been identified in our country. So guys, let's move on to the next one: how to
Yeah,
level up
I just would like
oxygen.
to add something. I just would like to add something on that also, Priya. That
Yeah.
according to WHO, this is the first ever pandemic caused by this particular way, this particular what is this virus
Mm-hmm.
ever before, according to WHO, caused by that.
Mm-hmm.
I think there's a code name for it. I don't have it now. And for the
Okay.
name, it's actually like alpha and earliest documented as at the UK, South Africa, and so on, right? So, because I heard and I read the international news that some countries are a little offended when it says that it is from India, the particular variant is from India. So probably we rephrase it as it was first reported in such country. Probably, I think that
Yeah.
will be nice in that case. So let's move to the next.
Okay. Okay. So Ranjini, over to you.
Yeah. So next, what we're going to cover is how it spreads, the symptoms and level of infection. So I
Yeah.
believe most of you guys, the viewers, you by right, you would have know this, but it's just going to be a refreshing session,
Mm-hmm.
and I'm going to take this on how it spreads. Basically, it spreads from an infected person through droplets. So
Mm-hmm.
when they speak or when they sing, if you're in close contact with them, or the distance, your physical distance is quite close to them, the droplets might end up into your mouth if you're not wearing a mask. So it might end up in your mouth or your nose, and yeah, you will get infected. So the infected person, apart from that, if they are like have a physical contact with another person who are not infected, that
Mm-hmm.
also chances for them to be what is this to be infected by this COVID-19 is high. And as you see, this infographic is from WHO. It also says that coughing, the action of coughing, talking, laughing, singing, and so on, and also through touch, like as shown in this infographic, like the droplets might also end up in your hand, on your hand, and you tend to touch all this doorknob or lift, and the your levels in the lift, and so the button in the lift, and so
Mm-hmm.
on. So all this, there's so many things through touch and through droplets.
Yeah.
Yeah, that's about it. And finally, get into your mouth, according to the infographic. And next, I'm
Mm-hmm.
going to touch on these symptoms. Basically, there are less common, most common, and serious COVID-19 symptoms. So this source is from WHO website. We took it. So basically, the less common symptom is sore throat, diarrhea, headache, rashes on your skin, aches and pain, or especially on chest area, and red or irritated eyes. But the thing is, the less common symptom is too common. To
Yeah.
be honest, is like it can be related to many other things, so it might be confusing. So I guess that is why some of the people tend to take these symptoms a little lighter, and end up, eventually they may get contracted with this COVID-19. So most common symptom will be fever, cough,
Mm.
tiredness, loss of taste. I guess tiredness and cough is something which is very common also, I would say.
Yeah.
Fever, it can be a common fever, but somehow it says that this is also can be attributed towards COVID-19 infection. And
Yeah.
the severe one is shortness of breath,
Mm-hmm.
difficulty to breathing, difficulty to breathe lah. Okay, chest pain,
Yeah.
and also loss of speech and mobility or confusion. Again, these are the indicators highlighted by WHO. These symptoms can also be a symptom of other related diseases. That is why some people at the beginning stage, they tend to take it lightly. I am one of them. So touch it. I'm not a COVID-19 patient. I've been infected, but
Mm-hmm.
I was the other way around. I took it very seriously whenever I have any of these symptoms. So yeah, that's how how you as a person interpret the symptom also matters before you get assistance from the medical experts. So that's about it. Next, Priya.
All right.
And then the third one that I'm going to cover is COVID-19 level of infection. So once you're already, you're already infected by COVID-19, you will show, these are the level of level of COVID-19 infection. So this is an infographic from KKM website. So it says that first, tidak menunjukkan sebarang gejala. You are not showing any symptom. So
symptoms.
this is the saddest part. You are not showing any symptom, but you are already affected by COVID-19. And number two is you have a light symptoms such as but without any radang paru-paru. Radang paru-paru is what, Priya?
Inflammation of the lungs. I mean, no
Inflammation. Okay.
inflammation of the lungs. It was the symptom was very light, and we couldn't sure whether it's COVID or not. And you might need to take a COVID test, the swab test.
Okay. And then the
Mm.
third one is you have the symptoms and also you have the inflammation at your lungs. Fourth
Mm.
is you have symptoms, you have inflammation in your lungs, and you need oxygen support. So I
Mm.
really came across a close contact of mine who have been in this stage and survived and came back healthily. Really hats off to that inspiring person. And fifth is critical symptoms, and you need intensive care. You need oxygen support and intensive care from ICU. So that these are the ranking of COVID-19 infection. So usually, I think for the first two or three will be asked. I think currently there are up to third. Is it? No, no, no. I think
Yeah,
first and second they will ask
first
to
and
you
second.
to do home quarantine at home. Yeah, right. And the rest, if you need help, you need to I mean, KKM will reach you, or you reach KKM. And if you need if you have difficulty to breathe, then you may be brought to the hospital by the ambulance will come and so on lah. All right, that's
Mm.
about it. This is based on, of course, we have gone through it for 1 year. We know suddenly most of the people whom we know are already infected by COVID-19. So this is some of my experience listening to those people. And let's move to the next prayer.
Okay. So just to add on, when someone is being assigned to do home quarantine, I mean, they have certain criteria to let the patient to do home quarantine, because it depends on the house, the area, like each and every patient have their own room and their own washroom, the restroom, and they're not sharing anything to another person in the house. So, or if they stay alone in the house, so some are the criterias. These are some criterias which the medical officers will let the patients to do home quarantine at home. And I think when they go to the level 3 and all those things, they might not be
Mm-hmm.
admitted into a hospital, but we have our CPRC, pusat
Mm-hmm. Oh,
pusat
yeah.
quarantine, which has been like for instance Might Serdang
Right.
from nearby the
Uh-huh.
UPMR.
Sedang.
So all those things, so they might be bring to the CPRC and all those things if they couldn't manage to do any home quarantine. And for fourth and fifth, definitely they need special care from the ICU, I think, which is currently happening, which is quite a bad situation for healthcare workers because the ICU are almost full. And we
Yeah.
really hope that this can be reversed as soon as possible. So we move to the third part, the best management practices. I mean, this is where the rules came in. So,
Yeah.
a crucial part. So, what is the best management practices to fight this pandemic? I mean, as always been told by our DG, our healthcare workers, and everyone in the media. So they always mention this 3C, 3Ws, 3C, which is mainly by crowded places, tempat yang sesak, confined space, tempat yang bertutup, and close conversation, bercakap secara jarak yang dekat. And we totally need to avoid all these 3Cs, definitely. And for what we have to do, the fundamental things that we have to do is this 3W, which is wash, of course, wear our face mask. And currently they have been advised to wear double face mask. And also warn, memberi amaran. I mean, whenever you see any of your colleagues or your friends or your family members were not following the SOP, you can warn them. It is not like, you are I mean, what to say, it's not like you mara them, you angry on them or what. No, it's like not like that. I mean, this is for the safety of everyone, because no one is safe until everyone is safe. So we definitely need to follow these 3W and need to avoid these 3Cs. And yeah. So what is this three S is the sesak sempit sembang dekat. So we have been talk about this just now. And kerap basuh tangan, penjarakan sosial. It is previously was social distancing, but currently it is physical distancing. You need to distance yourself from another person itself. It is no more social distancing. And guna pelitup muka. And currently they advise to wear the double face mask, which is we will describe in a while. So talking about the hand washing, this is this hand washing has been what to say our mother rules in whoever working under healthcare worker. We have our steps and all those things. So every time if you feel you touch something that might be used by someone else, which is you don't know, if you feel that you touch something, just go ahead and do the hand washing with like 30 seconds maybe. 20 to 30 seconds slide can take only that much of time. So these are some of the instruction, which is very easy, like this, 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 and wash. It is so simple, so simple. You just need to spend about 20 to 30 seconds for that. And that might help you to not being contracted with this COVID-19 virus. I think this is one of the best way to overcome this virus. And we go to the second part, which is the face mask. And okay, we go for this infographic on my right hand side, which is the pink color one. We see that one first. So what they mean by double masking, I mean, I think recently, right, by this year, our healthcare worker, our health care DG, Director General, have been advised whoever can do this double masking, especially if they go to any risky places such as like hospitals and any crowded places. If they have to go, really need to go, so they can practice double masking. And when you speak about double masking, it is not two medical or surgical mask or two fabric mask. No, the double masking, the right way to do double masking is the first layer will be our surgical mask and the outer layer will be our fabric mask. So that is what we call as double masking.
Probably
And
I can demo a bit maybe.
yeah, please,
So
please.
this is the surgical mask. I already have a knot.
Mm-hmm.
Okay, so this is I already have a knot. Yeah, I knew that some of them say that do not bring it up to the below your chin, but because my face is such that it's a little bit small, so what I did is I covered here, but it's completely sealed in a way. And
Mm-hmm.
here, when I put here, I'll press so that it follows my nose level so that nothing can go. And
Yeah.
at the end, I have made knot, and usually you'll have a space here. So space here, what I did is I folded inward and I stapled it. So
Mm-hmm.
that it's completely sealed. And I can't breathe. I
Mm.
mean, it's not barely could breathe easy. And then on top of it, this is the back. The fabric. Of course, you can put the knot, but for me, because I will wear face shield on top of all this,
Mm.
so I'm just for a demo purpose. So this is how people will see me. Basically when I'm out. So if you
Probably
see, like,
they
yeah,
couldn't
it's big,
identify
right?
it
So you can
still.
just fold it in, and then you can adjust it. My face is small. And then what I'll do is, I don't have my face shield with me, but I'll put a face shield. And the face shield, it's a kid size lah, because
Mhm.
the adults one is too big. So I'll just put it. It's completely like from here I'm covered up to
Mhm.
here. So this is how I go out. I have to take this out. I can't breathe. So this is how I do my double masking, and also I do put a face shield every time I step out of my house. So the
Yeah.
only place where I am without mask and the face shield is inside my house, and
Yeah.
probably inside my sister's house and so on. So don't be. I know some people. If I knew some of my friends told that I am like paranoid and so on. Like, I don't care. It's my body. my health, and if anything goes wrong, I have to bear it. So the same thing you guys also have to put in your mind, so that don't care about people around you who say you're so paranoid or whatsoever, because at the end of the day, anything happen to you, you have to carry the burden, you have to face the consequences, and it's not easy. It's never nice to be ill. So
Yeah.
just put that in your mind. I just wanted to chip in about that, Priya. Over to you.
Yeah, sure. I think when people talk about being paranoid, don't care, please don't care. It is our responsibility to do this. And this is free of charge. I mean, if you do this, there are a higher percentage that you won't be expose yourself, make yourself vulnerable to the virus. I mean, so why don't you follow? Just follow. And I'm sure I've been following the SOP until this moment. I think that's what saving myself from expose myself from this COVID. So just do whatever necessary has been asked by our Ministry of Health. So
Mhm.
speaking about the double masking, yeah, that is the right way to wear a double mask. So as how Ranjini demo just now, and if you have the N95 face mask, N95 is quite expensive a bit than the surgical mask. So when you wear the N95, you no need to wear a double masking. The N95
Mhm.
itself is good enough to do the perfect filtration. And yep, that's about it. And when you're using fabric mask, you need to regularly clean it. It is not like the surgical mask of single use where you wear and then you can take out and just throw it in a nice way, put in the plastic and then you throw it. You don't throw just like that. And about the face mask, which is in the fabric one, so you need to wear it properly first. Jangan pakai di bawah dagu. Yes. You can't wear like this, It have to be like this. And jangan menyentuh bahagian di dalam dan luar. So your hands are the what we call the higher chances of spreading the germs.
Mhm.
I mean, we touch
Yes,
everywhere,
you will.
We do almost everything by our hand. So don't touch the
Mhm.
outside part which is exposed to the air outside, or the inside part which is clean. I mean, it just touched our face. So don't touch both of this part. And jangan berkongsi dengan orang lain. This is definitely a big no. No, 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 no. This is
Mhm.
definitely a no. You can't pinjam face mask, that is no. So don't do that. Please don't do that. If someone asks face mask, if you have one, a new one, just give them and let them take it. So jangan letak merata-rata. This is definitely yes. Because, Ranjini, COVID virus, they have been said that it is like airborne right now. I mean, the aerosol
Okay.
particles will be flying on the air. It is like what we say.
It's very light that it can be. Oh,
Yes,
okay.
it will be in the air for some hours, and the gravity will do its part at the end. It will slowly come down to any atmosphere, any space that it can sit. Okay, so when you put your face mask anywhere else, and you wouldn't know how clean is that place, you know so don't put anywhere. If you want to take out, just take it out and throw. And when you want to wear a new one. No problem. But don't put it anywhere, because the particles will be there, and at the end of the day, it will come down to any surface. And when you put anywhere, the COVID virus won't take time to go and sit on your face mask. It just happened like that within split of seconds. So don't give chance to coronavirus to do that. And yep, jangan pakai pelitup muka yang rosak, longgar dan kotor. Dan juga basah, because all those things were what if it is wet, you won't feel comfortable definitely, and if it is already dirty, so you don't want to make it like worse, already you don't want to put a dirt one on your face, right? So don't do that. And the one that rosa, if it is not fit your face nicely, if got any damages, just don't do it. If it is longer, you can put a knot in the both side and tuck in the you will see a space when you put a face mask, right? So you just can tuck in inside, so that no space, no exposure to your this area, which is you can inhale air, your nose and your mouth. So this is very, very crucial, guys. How it is very important to wear a face mask. Much more important thing is to wear the face mask in a correct way, so that it can protect yourself from this coronavirus. And about
Yeah.
the fabric one, Every time you use the fabric mask, you need to wash it and clean it very regularly. And the surgical mask, just throw away. Hanya boleh pakai sekali sahaja, and don't wear it for too long, like tidak melebihi 8 jam. They advise tidak melebihi 8 jam. And if you have any symptoms like coughing or sneezing or anything, probably you need to change your face mask every 4 hours. That is best for you, because you don't want the germs to be accumulated in your face mask, because you're gonna inhale it back. And moving on.
Oh yeah,
Okay.
before that,
Yeah.
about I just would like to add on about the face mask. Okay, I still see whenever I go out, I still see people wearing it loosely. And they're not doing double masking. Not all are doing. It's because it's
Mm,
recommended.
yeah.
So most of them are with the what is this surgical mask.
Mm,
Another one thing is, like, for an example, in my case, I had an issue to get the right mask for me, surgical mask, because of you see, like, sometimes it's here, then it tend to be loose. I tried the kids one. It is too
mm-hmm.
small that, when I speak, it tend to open in the air. So basically, the idea of masking is to avoid any air or anything to come into. So
Yeah.
just hold on that, because when I refer to WHO, different countries, sometimes there are countries, those who have very sharp nose, right? They can't use
Mm-hmm.
the ordinary mask and so on. So it's actually understand the objective of wearing a mask, which
Yep.
is to avoid whatever droplets or anything to come into. So, however, you want to ensure it is like complete, it's sealed. You have to ensure that it is sealed, and at any point, even when you're talking, there are no ways for the air to come in. Lah. That is the idea of this objective of the wearing a mask. So
Yep.
yeah, it's sad that some people still are not aware. So probably this is why we're actually repeating it. So for you guys who are watching, the viewers who are watching, if you're not wearing your mask correctly, just take the tips from this session. These are all from KKM, WHO, and so on, and we have
Yep.
also demonstrated it. So make sure you do the masking rightly. That
Yes.
is
And
very
if you
important.
see, if
First
you
self protection
see
that you need to do.
Yep, right. It is self protection. And when you see anyone in front of you that not wearing the mask properly, educate them and let them wear the mask correctly. Just tell them, because I will do the same thing whenever I'm working in a hospital setting, and definitely I see a lot of people every day, the patients, and if they didn't wear the mask properly, I will definitely tell them. That is my responsibility to educate people also. So when we do the education, and when they follow, they will spread the right way of wearing a mask to other people who is not wearing the mask properly. I think we should no need to feel any lesser by doing this. We no need to feel like, oh, what they will think. No, no need, no such thing. Just educate people if they're not doing this rightly. So it is all
Yeah.
about learning. We're still learning. So let's go to
It's
the
for the benefit of all
fourth
of
one.
us at the end of the day, not only yourself, it's for all of
Yeah.
us also at the end of the day. Yes, so let's move to the next. But before that, I'm not
Mm-hmm.
sure. Yeah, for the viewers, if you would like to say hi, do say hi to us, and maybe I can take care of that part. And if you
Yeah.
have any question, a general question that we can pick up, then you can share it to us. Or you want to say anything or any suggestions, you can also type that in the comment box. We will
Yeah.
display it in our live session. So moving on to the next bit.
Yeah.
Okay, so the next thing is, if you see, the fourth one is what should we do? So Priya has already explained about all the pest management practices that one should adopt first. So it's always what you do. Next is what should you do to ensure that you are not contributing to the increasing case day by day,
Yeah.
and it's not to belittle or to say anything about those who are already infected. It happened. So for
Mm-hmm.
those who have been infected, what should you do? So this is the first part to general people who are not infected. So the first one is, if you see on the left hand side, is the infographic from KKM as well. So what he says is, number one, penitup muka, and we have discussed in detail about that just now. And then kerap cuci tangan. Okay, wear your mask, and then often wash your hand. And we have discussed that in Tara. Priya has explained about it just now, the steps. And then your physical distancing, which is ensure 1 meter with the mask, and you can speak. And right now, probably double mask and you speak. One of the obstacle is I faced is like when I'm wearing double mask with a face shield, they can't hear what I'm
Mm-hmm.
talking, and I ended up
Yes.
yelling, but still won't take out the my protections. But it happens. Just go through it. It's an experience that in future you will, you'll have to share to your maybe grandchildren or what. And then the
Yeah.
next is, especially currently with all these MCOs in place and so on,
Mm-hmm.
lockdown kandiri or self isolation. So you
Yep.
can do this. It not necessarily you need to be, infected. If you have nothing to do outside, just lock yourself down. I've been doing this like maybe not like for a very long, maybe 5 days I'll be in the house. I have all my food supply and so on. I'll be in the house. I won't go out of the house. And it is good actually. Basically, if you don't go out, if you're perfectly fine, if you don't go out, the probability for you to get infected by COVID-19 is very low, as
Yeah.
opposed to if you go out. So that's why the idea came about. And then optimum can, okay, they encourage to buy food online. So that is also, it minimizes your exposure to the public.
Yep.
Like if you were to go to the restaurant and order and wait, it's a long queue during this. It's just very long queue. So online purchasing is definitely something safer, and at the same time you guys can help those what is
Food
this,
delivery.
unsung heroes, unsung
Yeah.
heroes. So next is ensure that you have enough supply of basic needs, and you get it from the nearest shop. Don't like you're from one state, you go just because you like a specific supermarket in another district, you're willing to travel all the way. It is not advisable, definitely. So just get your important needs from the nearest shop. And then there's also one is like ensure that maybe a week supply you can buy ahead and keep in your refrigerator and whatnot. So that will be ideas how you manage it. And then do not allow visitors, zero visitors policy.
Yep.
You tend to get sometimes it's, yeah, you have to, especially it's like during festive season. I know it is tough that you can't have people, can't gather and so on, but I guess you know what, this happens like what, 100 year once, and we are the lucky, I will say. I'm not sure to say lucky or unfortunate, but it is an experience that not many people in the last 100 years experienced. So I
Yep.
guess you can look at that way and say that okay, we had a period that we did not receive visitor because of, to protect ourselves from being prone to get infected by COVID-19. So zero visitor policy. Of course, there's certain situations where you have to have a visitor. You don't call it a visitor, but according to this, you have somebody from not staying in your house from there. But we're going to discuss about that in another episode, coming episode, in which situations and so on.
Mm-hmm.
Moving to the next, yeah, they already say that ensure your grocery supply is sufficient for a week, and then ensure your petrol is full tank. The reason is I mean, the petrol station is not 24 hours now. You could hardly find one. No, not could hardly find one. You are not allowed to for 24 hours. It's been a
Yeah.
year that I mean, all this 24 hours thing is like inoperated. So this is also very important. In the middle of the night, if you are like having any health issues, you need to go to clinic or what, at least you have your car with a full petrol. This is my personal experience. Also, during this MCO 3.0, thank God, but I had two bus lah. Two bus, and the
Mm-hmm.
next day I had to go for some emergency thing, and then the next day I ensured, and every day since then I ensured that my petrol is at least half a tank lah, and so
Mm-hmm.
on. And this is for your safety, for your emergency. Trust me, you have to ensure
Yep.
that it's full at least half tank. And then this is for the Islamic people, that ensure your prayers, your solat berjemaah is together with your family lah. Okay, I think this is more towards the religious part, so we're not going to touch on much on that next.
Yeah, even other people like Indians who like to go to temples and so just stay home and do your prayers. Pray that all these things to come to an end very soon. So yep, let's go to this.
Yeah.
affected people.
And the next is for the infected people. So basically, I think we have shared earlier the level of infection, one, two, three, four, and five, whereby one and two will be like usually at the moment they'll be asked to go through self quarantine, right, Priya? And level
Yes.
three probably they'll send to the center for those who have a problem, having to isolate in their house and so on, right? So for these people, you have to self quarantine for yourself. I think there's a specific duration, 10 or 14 days, Priya.
Yep. 10 to 14 days.
Okay, so say if during this period, of course, when you're in self quarantine and you're already infected, you are not supposed to go out of the house lah. That's the first thing. And then
Mm.
when you're being isolating yourself, quarantine in your house, if you have these sort of symptoms like prolonged cough, and then you feel very tired, extremely tired,
Mm-hmm.
fatigue, and then you have prolonged fever, and you have difficulty to breathe, and hyperventilation, and then you can't eat or drink, and then you have diarrhea, vomiting, and so on. And then you have mental health issues. uh, I would like to highlight that if you have any mental health issues, during that particular this thing, you have to get help. You have to contact the emergency number, or you contact whoever, hospital, whatever, or your closest one, to get help for yourself.
Yep.
You have to take charge on during this situation. And of course, for those family members, I've heard about this, some of the sharing done in social media by their own family members, like trying to stay away, but they are being a little bit nasty lah. Of course they're trying to protect themselves, but you don't have to belittle those who are being infected and so on, right? So you have
Yep.
to keep an eye on them. You have phone, you can still talk to them, and ask if you just want to isolate yourself, also you don't want to get into contact, still call them and ask. They're your family members or even your friends, whatever it is, just give a call. And social media, I saw some of the people who are under quarantine. I'm really really glad that some of them they fall back to social media. Some of them shared their their quarantine period and so on. So thank God there's a social media. They can connect to so many people in the social media, and they share things, and there's a lot of like supports by their friends in social media. It's really good thing that is happening for some. But for those who are already, I'm sure if you are being infected, some of you can be at the lowest point of your life and you feel
Yep.
very worried and so on.
Mm-hmm.
Do not stop communicating. Ensure that you're
Yep.
continuously communicating with your close ones or your family members or whoever, because you are being quarantined, so we can't approach you and so on, right? So we need to know what's happening, right? So
Yep.
guys, if you guys are infected, ensure you do that. Keep communicating and also watch your symptoms, and keep it updated. You have to update in My Sejahtera also. I think that is one of the procedure. And yeah,
Yes.
that's about it. And if you need help, get help right away.
Yep.
Moving on to next,
So
Priya.
help yourself. Yeah. Help yourself and get the help that you need, because yeah, speaking about these mental health, I mean, that's a huge topic, that is a heavy topic. I think we will have that future in future. And yep,
Mhm.
when you mentioned about My Sejahtera apps, which is currently, I think, one of the application that every Malaysians should have in their phone. Have you have yours, Ranjini?
Yes, yes, I have mine.
Okay, so I'm just gonna do what I just want to demo my Sujatra apps. So this is our infographic on that. So on in the part of log, my Sujatra is, I think we all done that. So I think no much explanation needed for that. And usually at the beginning of when they invented this
That's enlarge a bit,
application,
Priya.
I think the major, come again.
Let's enlarge a bit the slide.
Oh sure.
Okay.
Okay, cool. Okay, the major reason and the most important function that we all been using is to check in into any shops or whatever premises that we are going to enter, because when you check in a place and if anyone who is infected by this virus at the same time checked in with you in the same place at the same time, my Sujatra application can automatically track it and inform you that you have been exposed to someone who is a positive COVID patient. So I think that information is crucial because we need to know where we went and our surrounding is safe or not, so that we will make sure that we're not spreading the virus to anyone else. So after that check-in, I think lot of other what we call features that been added to this application, so such as the QR code scanning, the hotspot. I mean, okay, when you speak about the QR code scanning, it will appear like this. Can you see the phone, Ranjini, clearly?
Probably straight to the camera. Close it. Okay,
Okay,
yes.
so what
Yeah.
we do is we will do this. Oh, sorry. Okay, so we will do this check-in, and this is what will happen. It will come out the scanning one, and pengesanan hotspot. So what we can do is we go to the My Sejatra, the home page here, and these are the features. So the hotspot status is this one. So you can find. Okay, let me put my area. Okay, so this is what will happen. It will alert you how many
Like a little bit too.
cases has been reported in your
Yeah.
place, and so that you would be more cautious on this. And it is also an alarming situation where you have to limit your movement to places, because the more you go out, the more you expose, the probability of getting exposed is very higher. And the lokasi facility saringan, okay, actually, there are a lot. COVID-19 status. Okay. We also have a help desk. Okay, I think by the time, guys, you also can get your smartphones and go into this
Yeah.
My Sajatra application and just
Let
go
me do
through
that.
every features. So we have a digital
Okay.
healthcare, a visual health advisory, and also you can book appointments for clinics. So we have system Temu Janji KKM if you want to go to any government setting clinics. So these are the things. And okay, if we go to the vaccination part, definitely you can vaccine register for vaccine for yourself, for your parents or your elderly that being staying together with you, and also the information about the vaccination is also available in your My Sujatra application. Okay, so moving on.
Speaking about it,
When you
Priya.
Yeah,
Speaking about it, Priya. So I think you have been vaccinated, right?
yes, I've been vaccinated at
And
March.
both doses, isn't it?
Yes, I've completed my vaccination
So,
doses.
so in your case, it will be reflected, right, in your My Sejatra?
Yes, correct. Okay. So I know most people were stuck at the second portion of it. It's okay, guys. You guys will get the call very soon. Just wait, and because the vaccination is quite a, what to say, a challenging task, which is you can't do just like that in 1 or 2 days. So yeah, give me a moment. I just doing something. All right. So if I'm already done my vaccination, this is what my screen would be like.
Okay. Maybe close a
So
bit.
all the ticks. would turn into green.
Yeah.
I've already
Okay.
done all those things.
Yeah.
And at the last part, you will get your certificate, the digital certificate that you have been taken both doses.
Okay. Maybe I can share mine. I have not got mine.
Yeah.
So you see, I'm waiting for my what is this appointment. So this is
Mm-hmm.
how it look like. I mean
Yeah.
my vaccination appointment. So I have not got my even my first listing. So this is how it looks
Mhm.
like look like in your My Sajatra.
Yep, correct. Okay, so if we also have another feature which is called more for squares. So these are the other actions which you want to choose. Got a lot, lah, actually, got a lot.
Mhm.
I also haven't go through everything like each by one, but I definitely had explored the features, whatever were included in the My Sujatra app. And the most important thing is when you check in, as I say, when you check into the premise, and if you are exposed to someone who is positive, and it will appear here, the things to do.
Okay.
It will appear here. I mean,
Things to know and things to do. Okay.
yes. Things to know is basically the statistics, the daily statistics,
Mm-hmm.
and all the important information. Things to do is the one, the medical officers or whoever checking the data, they will alert you what you need to do the next. If you are exposed to someone, and if you're exposed to someone, your profile will automatically change. Okay, this
Mm-hmm.
is low risk, no symptom,
Close it,
right?
Priya.
So it will be a blue color.
Close it. Okay.
Okay, and we also have casual contact without symptom. It will be a yellow color. Casual contact with symptom will be a dark orange, and if you are COVID positive, it will become red.
Mm-hmm. All
So
right.
if you are exposed to, this profile will automatically change color. And if you had done your any of your swab test before, for confirmation whether you are exposed to, so whether you are positive or not, and then result of the test also will be updated
Yes.
in your profile. So this is one of
Okay.
the result which I did recently. So it was that, and this is how your vaccination certificate will be look like, just to show.
Can we close up a bit, Priya? Close up a
Yep.
bit. Oh, okay. It's the yellow color. Okay.
Yeah, this is
Nice.
our digital certificate. Okay,
Mm-hmm.
so that's about it. And the things to know is probably all those statistics that also being
Cases.
shared in our KKM pages, official pages, and all those
Website.
things.
Yeah. Facebook
Yeah.
pages. Yeah. Wow. There was
And at
a.
the
There was
statistic
a.
part,
Okay.
yeah. At the statistic part, you also can see all the statistic, our R naught value, what is
Are
our
not. Yeah.
current cases, and active cases, case sumbo, and everything. And we also have a international, I mean, sorry, by states also we have. Of course, Slango is the winner. And this is the worldwide statistics, which also
Ooh.
you can see. It's it's quite worry to see the numbers. I mean, if it is my bank balance, I would be happy, but unfortunately. So yeah, that's about it. Quite a cool feature, and it has been invented
Yeah.
in a short period of time. I think
Uh-huh.
very useful, very useful. It's like a one-stop center where you can get all the information, and also at the same time, the
Mm-hmm.
authorities can track you to give the right information that you have to follow. I think my Sajatra application is one of the best way to one of the best way to tackle this pandemic
To
situation at our
track.
country.
Yeah, it
Yep.
is. It's an interesting. I mean, technology application to track and better manage. The spreading of this entire thing, and to ensure that the information reached fast to the people. And all of a sudden, they came with these apps called My Sujatra. Not many, actually downloaded it. I didn't download it. I because my phone is too packed with apps, so I wasn't into it. But I've been using QR code at the beginning to scan and so on. And
Mhm.
yeah, after sharing from you, there are actually quite a lot. I actually recently, during this MCO 3.0, I had so much of time at home. So I realized that I finally realized that My Sejahtera is indeed a useful apps, a smart thing which
Yeah.
the government came up very quickly. It's as though like they already know beforehand this is coming, and kudos to you guys and the brain behind this apps and so on. Okay,
Application.
so moving to
Yeah.
the next part. Oh yeah. So before that, for
Yeah.
the viewers who still don't have My Sejahtera, it is encouraged for you to download one and make sure you use it, although you don't frequently go out, because there are more than just you scanning. There are so many other things, information that you can get. You don't have to go
Yeah.
to separate places like their website and so on. Everything is there. So
Mm.
we suggest for you to have one in your phone if you have a smartphone. And yeah, let's move to the next and last part, Priya.
Yes, the last part is
Okay, I'm going to take this. So the last part is we're going to end this session today with the statistic cases in Malaysia. So we're going to
mhm.
link straight to the KTM website. Let's check it out so that I am aware what is the. You have to go to the full screen and click. Okay, while Priya is doing that part, basically, what is this? This entire thing you see from the beginning, we came with how it started. I mean, how we want to bring this entire short special edition is we are seeing this like a game. We're going to personificate it to a game, a video game, and what we're going to do is we have told you what is the game is all about. We have explained about the COVID-19, what is COVID-19, where it started, how it started, blah blah blah, and so on, and then we came to the rule of the game, which is things that you need to know, such as what is the symptom, what is the level of infection, and so on. We've described that in detail just now, and also we have also touched on pest management practices. So imagine you are in the video game now. You as a human, this is in real life, but imagine we facing this MCO and COVID-19 in real life, and it's a video game, and you're going to like, you are in the game right now, you know what is the rules, and you know what is the symptoms, and what are the symptoms, and you now know what are the best management practices in this journey of this video game. If you encounter certain things, infected people, if you're not infected, you're in home quarantine and whatnot, what you have to do and not to do. We've already touched on that. We have also touched on the best management practices and also on the what you have to do. So you are in the game. So what you have to do in this game, you've already touched on that as well. Your self lockdown and all your wearing a mask, washing your hand, and physical distancing, minimum 1 meter. And then we also touched on during this MCO 3.0 specifically is lockdown kendiri atau self isolation. And then also you have to ensure that your food supply stock, basic needs, you get it from the nearest grocery shop or shop nearest to your house, and ensure it is enough for a week, so that you don't have to go out frequently. And also you
Mhm.
need to have your petrol, refill your petrol in your car full tank, or at least ensure it's always enough for emergency cases. And also for the Muslims, you can have your prayers within your family members. And we also touched on what are the tools which will be given during this video game, which is you will be given this apps My Sejahtera for you to track. See if there are any enemies or whoever are coming approaching you, or you have accidentally had close
Bump
contact. I'm not
into,
going to
yeah.
call
Yeah.
enemy, but I guess in the game those with COVID-19 is sort of like an enemy or negative character in this video game. And then you have all this information if you got connected to them in contact, or you casual contact with them, all are available in that one tool called My Sejahtera. And last but not least, we're going to touch on what is the current status of this game. So
Mhm.
what is the number of the cases today? So Priya has shared the website, KKM's website, as for COVID-19, and today's case is, Priya, where can I see this? I think
Sitting here.
6,400, no, 6,045 cases today, new
Mhm.
cases. 20 is imported, and 6,025 is local cases, consists of 4,647 locals, Malaysians, and non-Malaysians are 1,378. So that is another 6,000. We are still above 6,000. I
Yeah.
think for the last 1 week or 10 days, I'm not sure. And the total cases, cumulative cases ever since first COVID-19 cases reported in Malaysia is 778,652 cases so far. And the good thing is 7,005 uh, 705,486 cases. Uh, people actually recovered from it, and they have been discharged. So that's the positive thing altogether. 90.6% of 90.6% of the cases, cumulative cases, have been they were saved and been discharged. And currently there are 67,669 active cases, and ICU. And as of today, ever since it was first reported in Malaysia, 5,497 lives have left us due to this COVID-19 infection. So that is an overview of this is the status, guys. So we are already in the middle of the game, video game, and
Yeah.
this is the status, how it is. And if you see the trend, maybe we can just see it is. I'm not going to go like a real statistician, and I'm going to read, tell you what this all this pattern. In general, it's been up and down. But if you see the range is not big. In the last
Yeah.
1, 2, 3, 4, 5, 6, in the last 6 days, we have been above 6,000 cases. And if you see, I think probably Priya can a couple of days before that we were consistently high, about 5,000 and so on. This is what, 2 weeks cases probably. So let's go back to
Yeah.
the top part, the cases. So this is what
Sure.
let's go to the top part. Scroll up again back to the graph. Okay, so basically, our right now, based on this status, and the government has already issued MKN in collaboration of all the agencies, they have came up with this phase one, phase two, phase three, and phase four. I think we
Mhm.
should have shared that. I'm not sure if you can find it anywhere in this website, Priya. But probably our first milestone is to ensure that the Ks are below 4,000, and there are few other criteria for us to move to phase two. So at the moment, there were good news that some states, I think Perak, Paha, and few other states have already moved to phase two. I think it was announced yesterday. Do you have the
Yeah.
states, Priya? What are the states?
Okay. Let me check.
Okay, while she's checking on that, and I'm really happy for you guys because some of the shops can be opened, like electrical shop. I've been like, I really wanted to go to an electrical shop to get some basic needs, but I couldn't because we are still KL and Selangor. We're still in phase one. So, and I think some hiking activities can be done at when you move to phase two, which is awesome. You can go to salon finally to cut your hair. You see, my hair is very long already. I can't go to salon, and just enjoy the process. And congratulations to you guys by state. And for the rest of us, especially Klang Valley, I know some memes, I've seen some posts and so on, that there is an attempt to take us out of our map, Malaysia map. Let's not fall for that. Let's work harder to ensure that the cases are reduced below 4,000. We can do it. Priya, we can do it. I'm from KL, you're from Selangor, we can do it. And definitely, I
Yeah.
mean, it's fun. Take it as a fun thing. Don't get too don't hang too loose. We are in a game, and we have to make sure we do our part, which we have already shared in our slides earlier, and ensure the case are brought down. It is okay for
Yeah.
you to what is this, you to correct another person who are not following the SOPs and whatnot, because it is a group game. It is not an individual game. Of course, it starts from an individual, and eventually it is the herd immunity that we are aiming for. At the end of the game,
Mhm.
the success of this video game is to achieve the herd immunity, and that is only achievable via vaccination. And we're going to touch on that also throughout this week. And anything else to add, Priya?
Yep. I just tried to get the MKN's website. Let me share that
Okay,
and
so
see whether we can
while that
find anything on that.
while that if you
Yeah.
You got it? So, guys, while
Let
that,
me
if
share
you
it.
have any, if you'd like to say hi or any comments or anything, any nice words to us, you can type that in the comment box and say hi to us. We'd love to say hi to you guys. And do share this live session to any page or any of your friends and so on, so that they can, or if you think that some of your close friends, they are not really following the SOPs or they are not so sure about the SOPs, it's fine that even till now some of you guys some of them do not know the SOPs and so on. Probably share this session to them, because we have covered pretty much all the critical things in this, and they can learn something from this session today. So you found it, Priya?
Okay.
Okay, so I have it actually.
You
You
have in
found
your
it?
phone, right?
Yes, I have it in my phone, so I will check on it. So I think, Priya, over to you.
Okay, so speaking about the phase one, phase two, phase three, and phase four, I think we still need to take some time to move. And as you said, the map, right? The Selangor has been cut out and put it as
Yeah,
a single country.
sampai
I think
mati.
my heart a little break when I see that. Okay, but it's
Exactly.
okay. I took it
But
in
you
a
guys
fun
have to
way.
understand, we are quite densely populated. You see,
Yeah,
we are quite
that's
densely
right.
populated. It's and it happens because we are very close. Yeah, but it's fine. We are still in the game. We are all in the game, so we'll do our part. And sorry for bringing you down for some of the states who, you wanted to take us out. Don't anak tirikan kita. We are all Malaysians.
Mm-hmm.
And I got the
Okay.
states. So Perlis, Perak, Kelantan, Terengganu, and Pahang. So 5 states have fulfilled 3 indicators to move to fasa dua, second phase of the
Mm-hmm.
PKP. So kudos to you guys. Please ensure you maintain all these 3 indicators and improve further. Do not reverse and come back. I really hope that the main thing is that throughout this MCO3, MCO3 has been, I think it is longer than MCO 1.0. Am I right,
Yes,
Priya?
definitely. Yes, yes, yes.
Yeah,
It's
I
a
think it's slightly
never-ending
longer than MCO.
MCO.
I mean, like the first lockdown. You see, I think when based on what we
Mm-hmm. Correct.
yeah. So
But
apart from
to the MCO.
the COVID, the obstacles. Yeah. Apart from facing the obstacles caused by COVID-19, the direct obstacles, the direct impact of COVID-19 itself to our health, there are so many side effects, I would say, and I would say the obstacles along the journey, fighting against this COVID-19, there's so many things came up, challenges. And that is what we're going to bring in the next few days during this special edition. And so stay tuned with us, guys. I think there are no questions from the viewers, right, Priya?
Yep, no questions from the viewers, just highs from the
Yeah, thank you
viewers.
so much.
So,
And
hi
hi,
guys.
guys.
Thank you for watching.
Hi,
Thank you for
Balaji.
joining us and keep, yeah,
Thank you for the support and so on.
some
So
loyal
I
followers.
guess
Okay.
I guess we are at the end of the show. We have covered everything that we about the rule of the game, this game, and in brief. And I've already repeated it. And so next is, as I said, other obstacles that came by in our journey to face this, to combat this COVID-19, and that is what we're going to select and discuss further in coming few more days. So as usual, we will share the topic on that respective day. So the next episode will be tomorrow, but the topic will be revealed tomorrow morning in our page. So stay tuned. Oh,
Yep.
hi, Mala. So we will reveal it tomorrow morning. So stay tuned. Do follow our page, like our page, share to your friends, and to those who will benefit from the content that we're going to bring to during this uh, special edition episodes. So until then, see you guys. Signing off. I'm Ranjini.
And I'm Devapriya. Bye bye. Good night.
Bye, guys.